When it comes to men's health, especially as we age, it's easy to confuse symptoms. What feels like a minor annoyance could be a sign of something serious. This is particularly true for bladder cancer and prostate issues. Both involve the urinary tract and share some common symptoms, making it tricky to differentiate between them. However, understanding the distinct characteristics of each condition is paramount for timely and effective treatment. Early detection is often the key to better outcomes. We'll explore the symptoms, diagnostic procedures, and treatment modalities for each condition. By understanding these differences, you can empower yourself to take charge of your health and seek appropriate medical attention without delay. Your health is your most valuable asset, and it deserves your utmost attention. The urinary tract, a complex network of organs responsible for filtering waste and eliminating urine, can sometimes throw us curveballs. Among the most concerning are bladder cancer and prostate issues. While they share a common playground, their origins, behaviors, and potential impact on men's health are vastly different. Bladder cancer originates in the cells lining the bladder, the organ that stores urine. This malignancy can be aggressive, often requiring a multifaceted approach to treatment. On the other hand, prostate issues encompass a range of conditions from benign prostatic hyperplasia, BPH, to prostatitis and prostate cancer, each with its own set of challenges. The prostate, a small gland beneath the bladder, plays a crucial role in male reproduction. Its enlargement, inflammation, or the development of cancerous cells can lead to a cascade of urinary symptoms that mimic those of bladder cancer. Distinguishing between bladder cancer and prostate issues requires the expertise of healthcare professionals who can accurately diagnose the condition through physical exams, imaging tests, and laboratory analyses. Bladder cancer often announces its presence through subtle yet persistent symptoms. Being vigilant about these warning signs can make all the difference in early detection and treatment. One of the most common indicators is blood in the urine, medically termed hematuria. While it might appear alarming, it's important to remember that not all instances of hematuria signal cancer. Other factors like infections or kidney stones could be at play. Alongside hematuria, changes in urinary habits should also raise a red flag. Frequent urination, especially during the night, can be a telltale sign. Pain or burning sensations while urinating, coupled with an increased urgency to go, shouldn't be ignored either. If you experience any of these symptoms, don't hesitate to consult your doctor. Early detection is key in the fight against bladder cancer. Diagnosing bladder cancer is like piecing together a puzzle, where medical professionals use various tools and techniques to form a complete picture. The journey often begins with a thorough physical examination and a detailed analysis of the patient's medical history. Urine tests play a crucial role in the diagnostic process. A urinalysis can detect the presence of blood, even microscopic amounts invisible to the naked eye. In addition to urinalysis, a cystoscopy often takes center stage in diagnosing bladder cancer. During a cystoscopy, a thin, flexible tube equipped with a camera and a light source is inserted into the bladder through the urethra, allowing doctors to visualize the bladder lining and look for any abnormalities. If any abnormalities are detected during the cystoscopy, a biopsy, the gold standard for diagnosis, is usually performed. A biopsy involves taking a small sample of tissue from the suspicious area for microscopic examination by a pathologist. This information is crucial for doctors to develop an effective treatment plan tailored to the patient's specific needs. Battling bladder cancer demands a multifaceted approach, tailored to the specific characteristics of the disease and the individual patient. Treatment options vary depending on the stage of cancer, its location, and the patient's overall health. One of the initial lines of defense is surgery, aimed at removing the cancerous tumor from the bladder. For early-stage bladder cancer, a procedure called transurethral resection of bladder tumor, or TURBT, might be recommended. During TURBT, a specialized instrument is inserted through the urethra to remove the tumor from the bladder lining. In more advanced cases where the cancer has spread beyond the inner lining of the bladder, a radical cystectomy might be necessary. This extensive surgery involves removing the entire bladder, along with nearby lymph nodes, to eliminate the cancer and prevent its recurrence. Beyond surgery, other treatment modalities like chemotherapy, radiation therapy, and immunotherapy play crucial roles in combating bladder cancer. Immunotherapy, a newer approach, harnesses the body's own immune system to fight cancer cells. The prostate, a small gland beneath the bladder, often takes center stage in men's health discussions, and for good reason. This walnut-sized gland, responsible for producing a fluid that nourishes and protects sperm, can become a source of concern as men age. While prostate issues are common, they encompass a spectrum of conditions, each with its unique characteristics and implications. Benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate, tops the list of common prostate problems. As men age, the prostate gland naturally grows, but in BPH, this growth becomes excessive, squeezing the urethra and obstructing urine flow. Another common concern is prostatitis, an inflammation of the prostate gland, often caused by bacterial infections. Prostate cancer, the most serious of prostate issues, occurs when cancerous cells develop in the prostate gland. Regular prostate cancer screenings are essential, especially for men with risk factors such as family history or certain genetic predispositions. The prostate, despite its small size, can make its presence known through a variety of symptoms, often signaling underlying issues that require medical attention. One of the most common signs of prostate problems is a change in urinary habits. Frequent urination, especially at night, can indicate an enlarged prostate pressing on the urethra, obstructing urine flow. Difficulty starting or stopping urination along with a weak or interrupted urine stream should also raise a red flag. These symptoms, often associated with benign prostatic hyperplasia or BPH, can significantly impact quality of life, disrupting sleep and causing discomfort. Another telltale sign of prostate issues is pain or discomfort during urination. This burning sensation, medically termed dysuria, can be a symptom of prostatitis, an inflammation of the prostate gland. Blood in the urine or semen, while alarming, is not always a sign of cancer. However, it warrants immediate medical attention to rule out any serious underlying conditions. Diagnosing prostate issues is like embarking on a detective mission, where medical professionals employ various tools and techniques to uncover the root cause of the problem. The journey often begins with a thorough medical history review, allowing doctors to understand the patient's overall health and identify any potential risk factors for prostate problems. A digital rectal exam, or DRE, a quick and relatively painless procedure, is usually the next step. During a DRE, the doctor inserts a gloved, lubricated finger into the rectum to feel the prostate gland for any abnormalities, such as enlargement, tenderness, or nodules. Blood tests, particularly the prostate-specific antigen test, play a crucial role in prostate cancer screening. PSA, a protein produced by the prostate gland, is often elevated in men with prostate cancer. If the DRE or PSA test raises concerns, further investigations are warranted. A prostate biopsy, considered the gold standard for diagnosing prostate cancer, involves taking small tissue samples from the prostate gland using thin needles guided by ultrasound. Managing prostate issues requires a tailored strategy based on the specific condition, its severity, and the individual patient's needs and preferences. For benign prostatic hyperplasia, or BPH, lifestyle modifications often serve as the first line of defense, especially in mild cases. Reducing fluid intake before bedtime, limiting caffeine and alcohol consumption, and maintaining a healthy weight can alleviate BPH symptoms. Medications, such as alpha blockers and 5-alpha reductase inhibitors, can help relax the prostate muscle and shrink the prostate gland, improving urine flow. In cases where medication and lifestyle changes prove ineffective, minimally invasive procedures like transurethral resection of the prostate, or TURP, might be recommended. Prostatitis, depending on the type and severity, might require antibiotics to treat bacterial infections, pain relievers to manage discomfort, and muscle relaxants to alleviate pelvic pain. Prostate cancer treatment options range from watchful waiting for slow-growing tumors to surgery, radiation therapy, hormone therapy, and chemotherapy for more aggressive forms of the disease. In the realm of men's health, silence is not golden, especially when it comes to sensitive topics like bladder cancer and prostate issues. These conditions, often shrouded in secrecy and stigma, can have a profound impact on physical and emotional well-being. Breaking the silence, seeking timely medical help, and sharing your story can make all the difference. Remember, you are not alone in this journey. Countless men face similar challenges, and sharing experiences can provide invaluable support, reduce feelings of isolation, and empower individuals to navigate their health journey with greater confidence. Support groups, both online and in person, offer a safe and confidential space to connect with others, exchange information, and find solace in shared experiences. Don't hesitate to reach out to healthcare professionals if you experience any unusual symptoms or have concerns about your urinary health. Early detection is key in managing both bladder cancer and prostate issues, and timely medical intervention can significantly improve outcomes. By speaking up, you become an advocate for your own well-being and inspire others to take charge of theirs. In the landscape of men's health, understanding the intricacies of bladder cancer and prostate issues is paramount. These conditions, while sharing some common ground, demand distinct approaches to diagnosis, treatment, and long-term management. Vigilance about our bodies, recognizing any unusual symptoms, and seeking timely medical attention are our strongest allies in this journey. Remember, early detection is often the cornerstone of successful treatment and improved outcomes. Ignoring warning signs or delaying medical consultation can have significant consequences, potentially allowing the disease to progress and limiting treatment options. Regular checkups, especially as we age, are crucial for maintaining optimal prostate health and catching any potential issues early on. If you experience any unusual symptoms or have concerns about your urinary health, don't hesitate to reach out to your healthcare provider. By staying informed, being proactive about your well-being, and seeking timely medical care, you can navigate the complexities of bladder cancer and prostate issues with greater confidence and empower yourself to live a longer, healthier life.